I'm Dr. Steve Frye, medical doctor, former medical school professor, and a decorated Green Beret veteran. My opponent is not a veteran. I came from a poor family. My ancestors arrived in this country seeking the opportunity, and I have lived the DREAM Act. I'm the first college graduate in my family, and I finished paying off my medical school loans when I was 49 years of age. I unconditionally support President Obama and his signature affordable health care plan. Nevada has the highest unemployment rate, the highest alcoholism and drug abuse, and the highest uninsured rates in the country. No state needs health care more than Nevada. I fully support it. My opponent does not. I also fully support the stimulus package that saved our auto industry. My opponent does not. I'm an environmentalist, so let's bring green jobs back to Nevada and the United States by re-legalizing hemp, our country's first crop. It reverses global warming, and it's a low-water product and manufacturing. It's great for food, textiles, fuel, wood, pharmaceuticals, and paper. We can immediately create hundreds of thousands of green jobs and revitalize our agricultural and industrial sectors. As a professor, I'm an educator. We must honor and respect our teachers and compensate them well. We cannot continue to be 50th in funding. I support the new initiative to fund education in Nevada. I'm a strong advocate of gifted education, and we need to establish gifted high schools throughout Las Vegas, Henderson, and North Las Vegas. Gifted students strive to excel and bring everybody else up. My opponent is the only Democrat not endorsed by the Nevada State Education Association. We must end our war on immigrants now. For decades, the United States had an open border with no checkpoints, and millions crossed it with no screening. So we share responsibility for the immigration problem, and we must now resolve it. The reality is we are never going to deport millions of good immigrants that have been living, working, and raising their families here for decades. Thus, I propose that we establish a system that allows people that have been here for years with no significant legal problems or arrests to get legal status. This is how our ancestors came. I completely support the DREAM Act. There are now about 750,000 foreign college students in the United States, and our current laws require these students to be deported after graduating, so we derive no benefit from them except their tuition. Our DREAM Act students all speak fluent English and would stay to become contributing needed bilingual professional members of our society. We must pass the DREAM Act now. America's 25,000 drug gangs kill 10,000 Americans every year, and Mexico's cartels murder 10,000 Mexicans yearly. Our drug war has been a devastating and deadly war, and Latin America is also paying the price. For this, we waste $100 billion yearly. That's $1 trillion over 10 years, and we have already squandered $2 trillion. We must stop the bloodshed and the financial hemorrhage and end our international drug war. The voters of Nevada voted for legal medical marijuana more than 10 years ago, and my opponent has blocked it in the legislature for 10 years. These are needy patients with cancer and AIDS and chronic pain, and they have been deprived of medical marijuana. Our drug war has made Mexico so tragically dangerous that our own State Department has issued travel advisories against Americans even visiting many parts of Mexico. Therefore, it's now immoral for us to deport these good, loyal men, women, and children back to a country that is so treacherous that we Americans cannot even safely visit. We therefore have a moral imperative to provide a path to citizenship, and we must do it now. I am a feminist, and I support the new Paycheck Fairness Act. Birth control pills save lives. The United States ranks 18th in maternal mortality behind Croatia and Kuwait. So an unwanted pregnancy results in an unnecessary risk of death for the mother, and we cannot do this. Birth control pills also avoid the risk of pregnancy and the mother's death. Women who use them also have a 50% reduced deadly ovarian cancer rate, and IUDs results in 50% less cervical cancer. Choice saves lives. I was a medical student before Roe v. Wade, and we had entire wards of infected women from illegal abortions in Washington, D.C. After 1973 and Roe v. Wade, these wards were closed. Just making something illegal does not mean that people do not do it. Prohibition didn't prevent alcohol abuse, and we have the highest drug use in the world with our war against drugs. The proof is that when abortions are available and legal, women's lives are saved. We have to continue to allow this to happen. I support all unions as they are the backbone of the middle class. I have a detailed plan to create union jobs. The unions would partner with the banks and companies that now own partially finished buildings and condos. The unions would cut their workers' hourly wage in return for becoming a part owner of the completed valuable project. The union, the workers, and the banks will share in this profit. It becomes a complete win-win for everyone. The union workers will either collect their made-up salary later, be part owners in the project, or allowed to live in these projects at a reduced rate. Saving lives is what doctors do. As a lifelong physician, I always want to stop needless murders, death, and suffering, all the hallmarks of our calamitous drug war. Our drug war absolutely kills many more people than drugs, and it's the most racist issue in America. The NAACP at its meeting last year finally voted to end the drug war because it does not work, and it is the most racist issue in America. The Global Commission on Drug Policy, consisting of 4 former presidents, Kofi Annan and Richard Branson, issued a report stating the drug war is lost, we can never win it.